Today I'm going to be presenting on Addison's disease. I'm first going to discuss the definition and etiology of Addison's disease. Addison's disease is also known as primary adrenal insufficiency. It's a disease that occurs when the adrenal cortex is either damaged or dysfunctional. The damage or dysfunction to the adrenal cortex causes decreased levels of hormones to be secreted and then released by the cortex. There are multiple different causes for Addison's disease. Addison's disease may be caused by an idiopathic autoimmune condition, which causes the adrenal cortex to atrophy. Other causes may include the surgical removal of the adrenal glands or infection of the adrenal glands. And TB and histoplasmosis are the most common infections that are related to adrenal or Addison's disease. Certain medications are also known to cause the development of Addison's disease, which include anticoagulants, anticonvulsants, such as phenytoin, antibiotics such as rifampicin, and corticosteroids. In fact, the abrupt cessation of corticosteroids is the most common cause for adrenal insufficiency. Now I'm going to discuss the pathophysiology of Addison's disease. The pathophysiology of Addison's disease depends on what is causing the condition. Autoimmune-related Addison's disease causes the patient's body to produce antibodies that attack enzymes within the adrenal cortex, which then causes the adrenal cortex to become damaged and dysfunctional. In turn, the cortex produces inadequate amounts of cortisol and aldosterone, which then affects the body's ability to control metabolism, blood pressure, and blood glucose, and to maintain normal nerve and muscle function. Clinical manifestations of Addison's disease are related to the deficiency of cortisol production and aldosterone production. So some of these clinical manifestations include muscle weakness, anorexia, GI symptoms such as abdominal pain, constipation or diarrhea, nausea and vomiting, fatigue, emaciation, dark pigmentation of the mucous membranes and skin. The dark pigmentation is especially seen on the patient's knuckles, knees, and elbows. The patient also will present with hypotension, depression, emotional lability, apathy, and confusion. Now I'm going to discuss the diagnostics and testing for Addison's disease. One test that's performed for the patient with Addison's disease is known as an ACTH stimulation test, and it's performed to determine the difference between primary and secondary adrenal insufficiency. To perform this test, ACTH is infused, and then the patient's serum cortisol levels are measured 30 minutes and 1 hour after the injection. This test is performed early in the morning because this is when the serum cortisol levels are most accurate. So as you can see according to the chart, in primary adrenal insufficiency, also known as Addison's disease, the cortisol levels don't rise and the plasma ACTH will be greatly increased, but the serum cortisol level will be lower than the normal range or in the low normal range. In secondary insufficiency, the levels are both low. Other ways to diagnose Addison's disease is through blood tests that look at important laboratory values such as potassium, sodium, and glucose. In patients that have Addison's disease, they'll often have low blood glucose levels, which is a level less than 70 milligrams per deciliter, low sodium levels, which is a level less than 135 milliequivalents per liter, and high potassium levels, which is a level greater than 5 milliequivalents per liter. As well, the patient with Addison's disease commonly has increased BUN and creatinine levels, which are greater than 24 milligrams per deciliter and 1.4 milligrams per deciliter respectively. The patient with Addison's disease also has a low serum cortisol level, which is less than 10 micrograms per deciliter if they are measured early in the morning. There are a couple different complications that can occur because of Addison's disease. An Addisonian crisis is a complication that can result due to Addison's disease. It is characterized by an acute drop in adrenocorticoids being produced by the adrenal cortex. Addisonian crisis may be caused when the patient suddenly discontinues taking glucocorticoid medications or can be induced by severe trauma, infection, or stress. Some signs and symptoms of Addisonian crisis are nausea, fever, pallor, confusion, weakness, tachycardia, tachypnea, and hypotension and shock. If an Addisonian crisis is left untreated, death may result, which is why prompt treatment is needed for a patient that presents with this condition. Another complication that can occur as a result of Addison's disease is hypoglycemia. Hypoglycemia is common in people with Addison's disease because decreased glucocorticoid levels cause increased insulin sensitivity and decreased glycogen levels. The patient should be aware of signs and symptoms such as shakiness, cool and clammy skin, dizziness, confusion, headache, and hunger. A patient with Addison's disease is instructed to always carry a snack with 15 grams of carbohydrates on them to prevent this complication of the disease. Hyponatremia and hyperkalemia are also complications that can result due to Addison's disease. The reason that these electrolyte imbalances are common is related to the decreased aldosterone levels, which causes excess sodium to be excreted and excess potassium to be reabsorbed by the kidneys. Some of the expected findings of hyponatremia can be remembered by utilizing the mnemonic SALT loss, which stands for S for stupor/coma, A for anorexia, which is often accompanied with nausea and vomiting, L for lethargy, T for tendon reflexes, which are hypoactive, L for limp muscles, aka muscle weakness, O for orthostatic hypotension, S for seizures/headache, and S for stomach cramping. The expected findings for hyperkalemia can be remembered through the mnemonic MURDER, which stands for M for muscle cramps, U for urine abnormalities, R for respiratory distress, D for decreased cardiac contractility, E for EKG changes, and R for reflexes. During this assignment, I embodied the NLN competency of spirit of inquiry. Learning about Addison's disease really piqued my curiosity in treatment options for this patient population. I learned that research supports treatment of Addison's disease using glucocorticoids such as prednisone and hydrocortisone, and mineralocorticoids such as fludrocortisone to treat the disease. These treatment options specifically replace the hormones that are deficient in the patient with Addison's disease. These hormones include cortisol and aldosterone, respectively. Teaching the patient about these medications is an important responsibility of the nurse. Some patient instructions include teaching the patient about the need for an increased dosage when the patient is experiencing increased stress or illness, monitoring his or her blood pressure and weight, and also avoiding discontinuing the medications abruptly. The nurse especially stresses the importance about not discontinuing the medications abruptly and tapering the dosage. So the reason that the nurse stresses this so much is that if the medication is going to be discontinued, that it doesn't cause the patient to experience the previously discussed Addisonian crisis, which can be caused by an abrupt cessation of these medications. That condition can be life-threatening to the patient and can result in death. If you could continue to this link for a brief survey of 3 questions regarding the information that was presented in this presentation.